By Wanyee LiStarMetro VancouverThu, May 17, 2018. Vancouver, BC healthcare workers are preparing themselves as Netflix is set to release its second season of 13 Reasons Why on Friday. The first season of the show was released in March 2017. Healthcare workers and mental health advocates were quick to criticize the show's dramatic depictions of suicide. The show's first season centered around a high school girl's decision to kill herself. The trailer for the second season hints at heavy topics such as sexual assault will be prevalent once again. This image, released by Netflix, shows Catherine Langford in a scene from the series 13 Reasons Why, about a teenager who kills herself. Beth Dubber, Netflix. Via the Associated Press, Dr. Ashley Miller is a child and adolescent psychiatrist at BC Children's Hospital. We saw more youth referencing the show as something that had triggered or increased suicidal ideation, and some who had traumatic reactions to some of the elements of the show, she said. The second season, with its ongoing themes of violence and bullying, as suggested in the trailer, could also harm people who suffer from post-traumatic stress disorder, she said. BC's Crisis Center keeps track of the nature of all incoming chats and calls, and says the number of calls from people younger than 13 talking about suicide doubled in 2017. On average, more than 40% of the calls from people under 18 are about suicide, according to Sandy Biggerstaff, Executive Director of the Crisis Intervention and Suicide Prevention Center of BC. The center fields an average of 40,000 calls and chats every year. Both Miller and Biggerstaff acknowledge the show has opened up the discussion about mental health for many people. But they say it also sensationalizes and glamorizes suicide. This person in the show, she gets lots of positive attention and power from what she does, and that can make it more appealing, said Miller. Biggerstaff encourages parents to suggest watching the show together with their children if they show interest in it. Parents or guardians who are concerned about their children's mental health can find resources at keltimentalhealth.ca and foundry.bc.ca. Youth in distress can access support at youthinbc.ca and youthspace.ca. Kids Help phone is available 24 hours a day at 1-800-668-6868. Top stories, delivered to your inbox. New NEWSLETTERHEADLINESSIGN up.